Britain appears to be heading for another lockdown as it battles a growing coronavirus outbreak. Prime Minister Boris Johnson could address the nation this week, and with more measures likely to be unveiled. Well, daily infections are rising by at least 6,000. That's the highest in 4 months. Cases are going up in every age group. Hospitalizations are doubling every 8 days. And the testing system is buckling under the pressure. Top British scientists say that the UK has turned a corner as there's no evidence the virus has become weaker.
Some of the things we've had to do are going to cause significant problems in the economy, big social impacts on mental health, and therefore ministers making decisions and all of society have to walk this very difficult balance. If we do too little, this virus will go out of control and we will get significant numbers of increased direct and indirect deaths.
Ollie Barrett joins us live now from London. Ollie, these numbers, it looks like exponential growth. Why is the UK seeing another virus rebound?
Well, one of the reasons that the government's chief scientific and medical advisors gave us during that presentation was simply that we are heading into winter and that this is a virus that will prosper under those conditions, the end of the British summer. Critics of the government will also say that part of the reason is that government messaging has sent people back to work, back into restaurants, back into pubs and bars, and they will also tell you that there has not been enough testing carried out as children have returned to school and as people have returned to work. Patrick Vallance and Chris Whitty, the chief scientific advisor and chief medical officer, set out a pretty stark warning that things are going to get pretty hairy this British winter, even if action is taken. They also set out a scenario where cases double every 7 days from here. They say that's not a prediction, but is a possible scenario. And under that scenario, they say by mid-October, we'd be seeing 49,000 confirmed cases a day in the UK. And they say at that point, a month after that, we would see 200 deaths per day in the UK. Now, opponents of further lockdown and other critics of the government are saying that that is a scare story, that the French and the Spanish outbreak curves have not moved in that direction. They're much slower than they were in March and April and February before that. Nonetheless, we certainly got a picture from the scientists today of an outbreak which is gathering pace and preparing the ground, I think, for more action coming from the government, and we expect to hear further detail on that from the Prime Minister this week.
Ollie, if a lockdown is to happen, is it likely to be as strict as the first?
I think Boris Johnson really very much hopes to avoid that kind of lockdown. Of course, the first time Britain had a lockdown, it enjoyed public support, but that would be harder to come by a second time around, I think, particularly given some of those criticisms about how the government has used the summer to get ahead on things like testing and tracking and tracing. Boris Johnson is holding a call today with the leaders of Scotland, Northern Ireland and Wales. He will on Tuesday morning hold an emergency COBRA committee meeting to discuss the next steps. And we've just heard, actually, in the last half hour, that Boris Johnson will address the House of Commons on Tuesday lunchtime, local time. So it may be at that point that Boris Johnson sets out some further restrictions. But he really does want to avoid a full-throated national lockdown if he can. We already have a number of local lockdowns in place in parts of the UK. The restrictions, I think, would not go as far as last time, but still may well be reasonably draconian.
Well, the challenges for tackling this outbreak just continue. Ollie, thank you very much for that. Ollie Barrett there in London.